Hello, everybody, and welcome to our webinar. Today, we're going to talk about the correlations between smoking and COVID. Your presenters for today is myself, Ephraim Lopez, and we have Fareen Farouk. We are both on the ACORNS team, which is who's doing this presentation today. Before we get started for the rest of our webinar, we will be referring to commercial tobacco or tobacco in this presentation, but I did want to mention that tobacco holds a sacred place among American Indians. It's a gift from the Creator. In California, tobacco is used in a variety of ways. It's used as an offering, and it may be offered to a fire in ceremony or with a prayer. Some offer tobacco when they take an animal or gather food or plant materials. Some offer tobacco as a sign of respect to an elder or a visitor. It's also used as a medicine for several purposes. It's grown traditionally, and when used only for traditional purposes, this webinar is intended to address the smoking of commercial tobacco as it relates to COVID-19, and in no way is it attacking sacred or cultural tobacco. For more information on sacred or cultural tobacco, please visit our website at www.crib.org, or you can email your ACORNS team members directly. So with that, I'd like to transition over to Fareen Farouk.
I'm Fareen. I'm going to quickly go over COVID-19. So what is COVID-19? COVID-19 stands for Coronavirus Disease 2019. The CO stands for Corona, VI for virus, D for disease, and 19 for 2019, because that's the year that the virus was found. Coronavirus, or COVID-19, is not the same as regular coronaviruses that commonly circulate among humans. These are the ones that cause the common cold and other mild illnesses. So how does COVID-19 spread? COVID-19 is a respiratory illness, so it mainly spreads between people that are within 6 feet of each other. When an infected person coughs or sneezes and those droplets are inhaled or land in the mouth or on the nose of people nearby, and also by touching a surface or object that has the virus on it, and then touching your own face, so your mouth, nose, or eyes. It's not known as the main way that the virus spreads, but it is one of the ways that the virus does spread. People are thought to be most contagious when they are the most symptomatic, so when they feel the most sick and show the most symptoms. Some spread might be possible before they show symptoms, so asymptomatic spread has been known to happen.
So one question I've been getting a lot as it relates to smoking or vaping, is it possible to spread coronavirus by smoking or vaping, or do you also increase your risk? So according to Tobacco Free CA, yes, when someone is smoking or vaping, they are repeatedly putting their hands to their mouths and faces. If the virus is on their hands, smoking or vaping can increase the chance that it'll find its way into the person's system. The risk can also be increased if the tobacco items shared, whether it's smoking regular cigarettes, vaping, or hookah, or a water pipe. If it often takes place in groups. So if you're sharing your cigarettes, for example, or your vapes, then you're increasing your risk. So the mouthpieces to the hose and the waters of the hookah can harbor and transmit bacteria and viruses from one user to another. This is a serious indicator that COVID-19 virus can also spread through hookah sharing in the same way as it would smoking or vaping.
What are a few symptoms of COVID-19? So patients with COVID-19 typically have mild to severe respiratory illness with the known symptoms of fever, cough, and shortness of breath. More severe cases include pneumonia in both lungs, multi-organ failure, and some cases death. But a few of the symptoms that have currently come up are fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea. So these symptoms may appear 2 to 14 days after exposure, and 80% of the cases have been shown to be mild, and many are asymptomatic. How can you protect yourself, your family, and your community? So, avoiding crowds, especially in poorly ventilated spaces, risk of exposure to respiratory viruses like COVID-19 increase in crowded, closed-in settings with little air circulation. If there are people in the crowd who are sick, obviously your risk of exposure severely increases. Avoid all non-essential travel, including any plane trips, especially avoid embarking on cruise ships. Clean and disinfect your home to remove germs. Practice routine cleaning of frequently touched surfaces. So this includes tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and most importantly, cell phones. And hand washing is way better than using hand sanitizer. So you should use hand sanitizer if water isn't readily available, but please wash your hands and don't touch your face.
Those are awesome precautions. One thing that we can also do to protect ourselves and our family is to quit smoking or vaping, and avoid secondhand smoke exposure. Now we'll get into these in a later slide, but if you quit smoking or vaping, then you're definitely improving your lung health, which will help protect yourself and your family if they are exposed to secondhand smoke. In fact, in one study of 1,391 healthy volunteers had 1 out of 5 respiratory viruses, including a coronavirus, dropped in the liquid into their noses. So this was a study to uh, find out um, whether or not you're at more risk from viruses or bacteria. The volunteers who smoked were twice as likely as those who did not smoke to develop an infection. So smoking is known to weaken the immune system and the body's ability to fight infection. This was not this particular COVID-19. Uh, Coronaviruses are a family of viruses, and that's how this study was performed. So quitting smoking or vaping definitely will help protect yourself and your family from COVID-19.
What to do if you are sick with COVID-19? So stay home, except unless you need to get medical care, it's safest if you stay home. So if you're mildly ill, you should isolate at home, and you should restrict most activities outside your home unless you're going to a doctor's appointment. Avoid public areas. So do not go to work, don't go to school. Public areas is in the mall that may be open. Avoid public transportation. So don't take the metro, the train, ride sharing, or taxis. Separate yourself from other people and animals in your home. So as much as possible, you should stay in a specific room and away from other people. Try to use a different bathroom. Ensure that you're having food given to you in your room if there are other people that are staying in your house so that you're not exposing them. And if you do have to go outside, please wear a mask. So avoid sharing personal household items as well. So you shouldn't share dishes, shouldn't share drinking glasses, cups, utensils, towels. Don't let your pets come in and out of your room if you're sick as well. And wash thoroughly after using any dishes or any items. Make sure that they're washed with like soap and water, not just rinsed. And if you do think that you are sick or if you have been tested positive for COVID-19, please let your doctor know before you come to visit so that the healthcare provider can take additional steps to ensure that everybody else around them is going to be safe.
Yeah, that's awesome. Also, kind of as mentioned before, uh, if you are sharing cigarettes or vape pens, it's increasing your risk. So one thing you can do if you are sick and you are going to smoke or vape, don't share your cigarettes with anyone if you know that you are currently ill. Or even if someone's, the colloquial term for it is bumming a cigarette. So if someone's like, hey man, you got to smoke, and you know that you're sick, you can try to refrain from that as much as possible if you are already smoking, because you don't want to, inadvertently pass on something that uh, someone's going to put in their mouth and then, develop COVID-19 from.
Also, clean your hands often. So wash your hands with soap and water for at least 20 seconds. I think also just you could sing the happy birthday song or any other song that's a little bit longer, especially if you've been blowing your nose, coughing, sneezing, going to the restroom. Wash your hands before eating or preparing food. Even if you're the only person in the house, please wash your hands. If soap and water isn't available for some reason, you can use hand sanitizer. And if you're using a hand sanitizer that has been created at home, ensure that it has at least 60% alcohol. And I think the best thing to do is use soap and water. It's probably also good to use soap that isn't bad for your skin so that you're not going to be drying out your skin and causing cracks, because you don't want there to be you don't want the skin to be ripping, because then that also increases your risk. But just wash your hands.
Yeah, my favorite is the ABCs. And then, when you get to the name part, I always point at whoever's in the room while I'm doing my ABC song.
Oh.
So just a tip. Also, in terms of cigarettes, as we kind of covered already, by nature, smoking is associated with a hand-to-mouth exposure, which increases your risk of contracting the virus. And as Farine was saying, you can hand sanitize, not as good as hand washing, but still better. So if you are going to use the hand sanitizing route and you are going to smoke, please, 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 please let your hands dry before you light your cigarette, because hand sanitizer is alcohol based and it is flammable and you will burn your face, or you're very likely to burn your face. So if you're going to hand sanitize and smoke and use that as your safety precaution and you're not willing to quit, please wait for the hand sanitizer to dry. We don't want to cause any harm to anyone.
So some other important information. We get lots of questions about vaccines. So currently, there is no vaccine developed. There are many vaccines in development, but none has been approved to protect against COVID-19. Treatment-wise, there is no specific antiviral treatment for COVID-19. However, I know that there are many trials in place to assist people that have been admitted into the hospital for a while. Quarantine. So an important strategy to reduce spread is to separate the people that have been exposed to COVID-19 from those that have not been exposed. This doesn't just mean those that are showing symptoms. This means anybody that may have been exposed. So quarantine yourself for at least 14 days. And if the symptoms last, if you do get sick and your symptoms last longer than 14 days, then please stay in quarantine until the symptoms have gone away, essentially. Travel, limit all non-essential travel. So consulting state and CDC guidelines for travel restrictions or recommendations is also important, but also your county and city guidelines. In California right now, travel has been limited, but even when it does open up again, it is important to limit your travel unless it's an extreme necessity. And now I think another question you get often is it just allergies, or do I have COVID-19? Do I need to go get tested? And so similarly, yes, the runny nose could be a sign of COVID-19, but it's also related to congestion, and it wouldn't just be a one-day thing. So itchy eyes and runny nose are likely to be allergy symptoms. And if you do have seasonal allergies and you know that the pollen count is higher that day, or whatever you're allergic to is higher that day, could be allergies. If you are worried, there are lots of places that you can get tested. So please do not fret and get tested if that is something that you're worried about. But usually there isn't a fever related to allergies, and that's the biggest symptom related to COVID-19. So who's at greatest risk? Increased risk of exposure for COVID-19 is usually those that are in close contact with someone known to have COVID-19. So healthcare workers or a household member of somebody who has been diagnosed. So if somebody in the area that you live in, let's say you live in a community that had a recent outbreak, and you may not have had direct interaction with with people that have been tested positive, but you are still at higher risk of exposure because you live in the area that had an outbreak. Increased risk of severe disease from COVID-19 are older adults, people who have serious chronic medical conditions like heart disease, diabetes, and lung disease. Another known one is asthma, and long-term smokers and e-cigarette users. You wanna?
Yeah, so smoking doubles your risk of developing respiratory infections, and this is shown to be true in long-term smokers and e-cigarette users have a higher risk of developing chronic lung conditions and severe infections associated with severe cases of COVID-19. Lung disease caused by smoking includes COPD, which includes emphysema and bronchitis. So if you smoke or vape and you get COVID-19, you increase your risk of developing more severe COVID-19 symptoms. You don't necessarily uh, are at a increased chance of getting COVID-19 from anyone out in the population if you're not, sharing cigarettes or vape pens, but you are at increased risk of developing a severe illness. Smoking and vaping lowers your lungs' immune response to infection, and COVID-19 affects the lungs. So people who smoke are at higher risk of developing that severe infection, along with older adults and everyone else that we've kind of laid out here. Individuals with compromised immune systems and individuals who have underlying medical conditions such as hypertension and diabetes, like Farine mentioned. In the big picture, your lungs work better when you don't smoke or vape, and COVID-19 affects the lungs. So the healthier you can keep your lungs, the better chance you'll have if you are to contract this virus. In a review of 5 studies that were published to date, and there may be more at the time of this recording, but smoking is most likely associated with getting sicker from COVID-19. Some of these were early studies coming out of China. In the largest study of 1,099 people with COVID-19, people who smoked were 2.4 times more likely to get severely sick. And by that, they mean, in that study, they mean it was admitted to an intensive care unit or needing medical ventilation or dying. So that's what they meant by really sick. This isn't really sick like, oh man, I was really sick at home. This is hospitalizations or death. And that was compared to those who did not smoke from some of those early studies. And again, this is a relatively new virus, or it is a new virus. So there isn't an extraordinary amount of studies coming out, and this is the best guidance we can give at the time. Smoking also can cause chronic obstructive pulmonary disease, or COPD, and other health problems that may contribute to serious illness, which also puts you at increased risk of developing severe illness from COVID-19. So stopping smoking is still really helpful for your health if you have COPD or heart disease. And even when COVID-19 isn't around, stopping smoking still will increase your chances of not developing COPD and heart disease, which in and of themselves are pretty awful.
One more thing I wanted to mention was that pregnant women should be considered a vulnerable population. They aren't listed as having a very high risk of developing severe disease, But when you're implementing mitigation measures, you should consider them a vulnerable population. Yeah.
Right. Oh, I guess one thing to consider too is kind of some of these compounding effects. There isn't very many um, studies on it, but it is something for you to consider if, for example, you are 65 and older and you also have smoked your whole life and you have COPD. So then those risk factors kind of compound on each other. So risks and harms associated with e-cigarettes for those that are saying, well, I don't smoke, I vape. So there are still some harms associated with vaping. For example, E-Valley, there was an outbreak of e-cigarettes or vaping product associated lung injury. Long name, long-winded, E-Valley is what we're calling it. So as of December 10th, 2019, which seems like an eternity ago, a total of 2,409 cases of hospitalizations from E-Valley have been reported to CDC. And this was an outbreak, which on the scale for COVID-19 is significantly smaller. But 52 deaths have been confirmed in 26 states and the District of Columbia. What this is growing evidence that has suggested that an aerosol from vaping devices can harm lung and at the cellular level and worsen the body's ability to fight respiratory infection. The recent outbreak of E-Valley is predominantly affecting young people and it's still a major public health concern. So this hasn't gone away. This is a risk from vaping during a pandemic. Um, the There's also potentially harmful chemicals that we don't necessarily know of yet. But some of the ones that we do know of are diacetyl, which is a chemical used in the flavorings for vaping devices or e-cigarette devices, which causes something known as popcorn lung. And that is a kind of the nickname for the disease. But what it does is it damages the lung alveoli. The alveoli are the tiny air sacs in your lungs that actually do the transfer of oxygen within our lungs. And with E-Valley, one of the things they found was that it was associated with vitamin E acetate, and that basically kind of coated the lungs, and it wasn't able to transfer oxygen anymore. What that did is it resulted in some lung injuries. As you can see from the x-ray, that is an x-ray from someone with E-Valley. Vitamin E acetate usually does not cause harm when it's ingested as a vitamin supplement or applied to the skin, but research suggests that vitamin E acetate, when vitamin E acetate is inhaled, it may interfere with normal lung functions. So these are things to consider while we're in a pandemic. So if you're thinking of switching from smoking to vaping as potentially being less harmful, since we're all stuck inside, you may not want to expose your children to secondhand smoke, and you're considering vaping. These are some things that you may want to consider before making that switch, as opposed to maybe quitting altogether or reducing the amount of cigarettes that you smoke at the very least. So what happens to the lung when you smoke or vape? Humans are human lungs are really delicate. When you smoke or vape, you're inhaling a number of chemicals and small particulates into your lung, particularly with vaping. We know that smoking and vaping is associated with inflammatory process in the lining of the lungs, which is the very place that COVID-19 causes the most serious infection. Smoking, vaping, and hookah and COVID all harm the lungs. So again, the big picture is all of these things are all harming our lungs. So the more we can keep them out of our lungs, the better we can fight COVID-19 if we were to get infected. So maybe with all of that kind of bad news, what can we do about it? So in terms of public health or health care, and even community members, we can do the same thing we've been doing and public health with cigarettes, and make sure that our youth understand the risk as they do with cigarettes. So I say youth because primarily the big problem with vaping has been historically with our youth, especially in the more recent years. The most recent Surgeon General report on smoking's key findings confirms that nicotine replacement therapies works, but that few people that want to quit are actually trying it. So we can promote NRT. One resource that I want to say that is available to us here in California, where the ACORNS team is, and that's the population that we serve, is the California Smokers Helpline. And right now they're supplying, well, until supplies last, they're supplying callers that are trying to quit with free nicotine replacement therapy delivered to your door, so long as you're attempting to quit. And I believe you just call them, you go over a quit plan, and they'll send them over to you. So for those of you that don't know what nicotine replacement therapy is, so that's a pharmacotherapy. It's available through it's available over the counter. You don't need a prescription for it. It comes in gum form, which you would chew, and you would use the chew and park method. So what you would do is chew, 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 and then you feel like that peppery, tingly feeling. That's the nicotine, and you place it in your gums, and you let it sit there to absorb. You can also have lozenges, or you can use a nicotine replacement therapy patch, and those come in different strengths. I do have a video that talks about all the different resources out there, and if you need specific training on pharmacotherapy or nicotine replacement therapy or anything like that, feel free to reach out to us. There's also Chantix and Zyban. These are prescription only. Chantix blocks the nicotine receptors in your brain and body, making it easier for you when you do hit your quit attempt. Zyban is an antidepressant, but it's also used for smoking cessation. And again, those are by prescription only. There's many forms of these, and there's many brands, but this is just a quick overview of something that we can do. There's also counseling or cessation counseling. This could be group cessation counseling or phone counseling. I'm sorry. So right now with COVID-19 precautions in place, many of these probably aren't going to be in person. So one thing we can take advantage of is phone counseling or application-based counseling. The California Smokers Helpline is a state helpline that's available for free, and that's a great resource to use right now that maybe our in-person therapies have been hindered for the time being. So there is messaging. There's health education messaging, which for public health, that is something like what we're doing now to get the right information out there for people to have. There's text cessation counseling. So the California Smokers Helpline, I'm referencing them again. I don't work for them at all. I don't get paid by them. They're just the state helpline that I like to use as an example. But they do offer text messaging counseling, or you can set it up so that if you're trying to quit on your own, they can still send you motivational text messages with some facts and tips scheduled for whenever it is that it's the toughest for you, that you're facing a quit attempt. They also have a myriad of cessation apps, many of which are personalized to you. What else can we do? Say we are the friend of someone that we're trying to help quit, or if we're a family member and we want to get Uncle Joe to quit or something like that, right? But maybe they aren't so receptive to it, but you still want to try to help people that are smoking. So we can look at policies against electronic nicotine devices, or colloquially known as vaping or vapes. We can look at policies against flavor. Here in Sacramento County, there is a flavor ban that went into effect recently. There has been some national policies that have gone into effect recently. Big Tobacco is found some ways around that. We can look at age restriction policies, marketing restrictions so that vaping companies don't market to youth, including social media. And we can do that on a federal, state, and local and tribal levels. So with that, we've reached the end of our presentation. Now we have a couple of frequently asked questions that we'd like to have addressed. So one question that I've received, we kind of spread them out throughout the presentation here. So I've received a question that there's a rumor circulating from research found that was coming out of France that I believe states that nicotine protects smokers from COVID-19, and it could be used as a possible treatment option. So is this true or false? Or is this a rumor? Or is it an actual study? So according to Tobacco Free CA, no, it is not true. And I second that. In no way is it true that nicotine protects smokers from COVID. Smokers are considered as high risk for a more severe illness of COVID-19, as we've lined out throughout this presentation. So unsupported claims like that rumor or that study have no place in public health. Articles, that article that was coming out of France, I forget the title of it, had significant research limitations. It was a cross-sectional observational study with a very small sample size from, I believe it was only from one hospital, and it was not peer-reviewed. Peer-reviewed is typically the standard of any scientific research or articles. So it doesn't really hold too much of a merit, in my opinion. One of the authors, I believe, has a long history of being funded by big tobacco companies. But unfortunately, this type of unfounded or not very good research, in my opinion, that has inflammatory headlines and misinformation really puts people's life at risk. So I just wanted to address that. And if you've heard that rumor that nicotine protects smokers from COVID-19, no, that is not true. It is completely false. And quitting smoking or vaping is one of the best things that you can do for yourself and your family, especially right now in a global pandemic from COVID-19. So with that, we'd like to thank you for sitting through this presentation. Hopefully you guys learned something. As always, you can contact your ACORNS team, and we are available to you guys.
Thank you.